In this podcast episode, Dr. Alok Kanojia, a Harvard-trained psychiatrist specializing in the intersection of technology and mental health, discusses a wide array of topics related to addiction, technology, and mental health. Dr. Kanojia provides insights into how modern technology, particularly in the form of video games and adult content, affects our mental well-being and social interactions. The conversation delves into the nuances of addiction, the impact of technology on identity and purpose, and the challenges faced by individuals with ADHD. Dr. Kanojia begins by discussing the nature of addiction, emphasizing that it is not merely a matter of willpower, but rather a complex interplay of biological, psychological, and social factors. He explains that addiction often stems from a numbing of emotional experiences, which can lead to dissociation and a loss of identity. When individuals become disconnected from their emotions, they struggle to find purpose in their lives. This lack of purpose can drive them to seek solace in technology, leading to a cycle of addiction that is difficult to break. He highlights the alarming rise in technology usage and its correlation with worsening mental health issues, such as anxiety, depression, and suicidality. Dr. Kanojia points out that the developers of technology understand the human brain better than most individuals do, creating products that are designed to capture attention and foster dependency. This creates a situation where people are increasingly turning to technology as a coping mechanism, further exacerbating their mental health struggles. The conversation shifts to the impact of technology on personal identity. Dr. Kanojia explains that our sense of identity is formed through the integration of emotional experiences. When individuals numb themselves to these experiences through excessive technology use, they lose touch with who they are. This disconnection can lead to feelings of purposelessness and confusion about one's identity. He emphasizes that the rise of social media and online interactions has created a distorted sense of self, where individuals compare themselves to curated versions of others' lives. This comparison can lead to feelings of inadequacy and a further detachment from one's true self. Dr. Kanojia argues that understanding one's identity is crucial for developing a sense of purpose, and that technology often hinders this process. Dr. Kanojia delves into the relationship between trauma and emotional numbing, explaining that trauma often begins with the suppression of emotions. This suppression can lead to dissociation, where individuals disconnect from their feelings and experiences. He notes that this dissociation can create a cycle of avoidance, where individuals turn to technology as a means of escape. The discussion highlights the importance of addressing trauma in order to break the cycle of addiction. Dr. Kanojia suggests that individuals must confront their emotional experiences and learn to process them in a healthy way. This can involve seeking therapy, engaging in mindfulness practices, or finding supportive communities that encourage emotional expression. The podcast addresses the increasing prevalence of technological addictions, particularly among younger generations. Dr. Kanojia notes that the average person spends 4 to 6 hours a day on their devices, often without realizing the impact this has on their mental health. He argues that this excessive screen time contributes to a decline in social skills and emotional regulation, making it difficult for individuals to form meaningful connections in the real world. He also points out that the design of many digital platforms is intentionally addictive, using techniques that exploit the brain's reward systems. This creates a situation where individuals are constantly seeking the next dopamine hit, leading to a cycle of compulsive behavior. Dr. Kanojia emphasizes the need for awareness and education around these issues, particularly for parents and caregivers. Dr. Kanojia discusses the inverse relationship between technology use and mental health, noting that as technology usage increases, mental health issues also rise. He highlights the correlation between excessive screen time and conditions such as anxiety, depression, and body dysmorphia. This relationship is particularly concerning for younger individuals who may be more vulnerable to the negative effects of technology. He explains that the brain is designed to thrive on real-life experiences and social interactions, and when these are replaced by digital interactions, individuals may struggle to find fulfillment. Dr. Kanojia advocates for a balanced approach to technology use, encouraging individuals to engage in activities that promote mental well-being and social connection. The conversation touches on the roles of dopamine and serotonin in addiction and mental health. Dr. Kanojia explains that dopamine is associated with pleasure and reward, while serotonin is linked to feelings of contentment and well-being. He notes that excessive engagement in activities that stimulate dopamine release, such as gaming or consuming adult content, can lead to a decrease in serotonin levels. This imbalance can create a cycle where individuals seek more dopamine-driven activities to compensate for their lack of serotonin, further perpetuating their addiction. Dr. Kanojia emphasizes the importance of finding a balance between activities that stimulate dopamine and those that promote serotonin, such as exercise, social interactions, and mindfulness practices. Dr. Kanojia addresses common misconceptions about meditation, explaining that many people approach it with the goal of quieting their minds. He emphasizes that meditation is not about stopping thoughts, but rather about observing them without attachment. He discusses the different states of meditation, including samadhi, which is a state of deep concentration and awareness. He argues that many individuals get stuck in the initial stages of meditation, focusing on their breath or thoughts without progressing to deeper states of awareness. Dr. Kanojia encourages listeners to explore various meditation techniques and find what works best for them, emphasizing that meditation can be a powerful tool for emotional regulation and self-discovery. The podcast explores the unique challenges faced by individuals with ADHD when it comes to meditation. Dr. Kanojia explains that traditional meditation practices may not be effective for those with ADHD, as they often struggle to focus and restrain their thoughts. Instead, he advocates for alternative approaches that involve sensory stimulation and movement. He suggests that individuals with ADHD can benefit from meditation practices that allow them to engage their senses and move their bodies. This can include walking meditations, mindful movement, or even engaging in creative activities that promote focus and attention. Dr. Kanojia emphasizes the importance of finding a meditation practice that aligns with one's unique cognitive profile. Dr. Kanojia discusses the importance of community in the recovery process for individuals struggling with addiction. He emphasizes that addiction thrives in isolation, and finding a supportive community can be a crucial step toward healing. He encourages individuals to seek out peer support groups or online communities where they can connect with others who share similar experiences. He notes that sharing experiences and challenges with others can help individuals feel less alone and more understood. This sense of belonging can be a powerful motivator for change, as individuals realize that they are not the only ones facing these struggles. Dr. Kanojia advocates for creating safe spaces where individuals can openly discuss their experiences without fear of judgment. The podcast addresses the challenges faced by parents in the digital age, particularly when it comes to managing their children's screen time and technology use. Dr. Kanojia emphasizes that parents must adapt their parenting strategies to address the unique challenges posed by technology. He encourages parents to engage in open conversations with their children about their technology use and to seek to understand their perspectives. He suggests that parents should focus on creating meaningful experiences in the real world and encourage their children to explore their interests outside of technology. By fostering a sense of curiosity and adventure, parents can help their children develop a healthier relationship with technology and reduce their reliance on digital distractions. Dr. Kanojia emphasizes the importance of purpose and direction in overcoming addiction and improving mental health. He argues that individuals who lack a sense of purpose are more likely to turn to technology as a coping mechanism. By helping individuals identify their passions and goals, they can create a roadmap for their lives that is not reliant on technology. He encourages listeners to reflect on their values and aspirations and to take small steps toward achieving their goals. This sense of direction can provide individuals with the motivation they need to make positive changes in their lives and reduce their reliance on addictive behaviors. The podcast concludes with a discussion about the future of mental health in relation to technology. Dr. Kanojia expresses optimism about the potential for technology to be used as a tool for positive change rather than a source of addiction. He advocates for the development of digital platforms that promote mental well-being and encourage healthy behaviors. He emphasizes the need for continued research and education around the impact of technology on mental health and encourages listeners to be proactive in seeking out resources and support. By fostering a culture of awareness and understanding, individuals can navigate the challenges of the digital age and prioritize their mental health.